Let's move to our next tab in the Surgery Navigator, PACU to Discharge. You'll see that those start off with notes again. This is where you can interact with both your brief op note and your full op note. All of the functionality here is the same as what we've already looked at under the Notes tab or the Notes Activity tab and the H&P pre-op note in our previous place in the Navigator. So we'll kind of move on through there. Discharge instructions allows you to pull in from here kind of the best practice or already established patient instructions piece. These are pre-built and clinically reviewed so that the information in them is fully accurate. You do have the opportunity, if you come down here to your butler with the question mark, the ability to bring in other things that are of interest to you here, your own smart phrases, templates, that sort of thing. We're going to go ahead and close this for the moment. Patient instructions is the place where you can select patient-facing instructions that are, again, sort of the pre-built pre-built instructions that correspond to the things that you've ordered on discharge, medications, those sorts of things. Follow-up care is where you have the opportunity to place notes, but not orders, about where and how your patient should follow up. What I mean when I say notes as opposed to orders is kind of important in the sense that these are definitely instructions as opposed to discrete orders. So when you enter things here in the follow-up care window, and in fact, let's just go ahead. We'll go ahead and just click on one here. Let's say that you want them to follow up with their PCP. That brings up your little details box here where you can select the length of time that you want to work through. You can add some instructions, further instructions, and accept that and put this here. Now this will show up on the patient summary. This isn't a structured order for a referral, and so nothing is triggered in Epic when you do this. This is just something that's put on the after visit summary and put in the notes, but it won't actually be routed out to anyone. So if there are other elements there that you need to interact with in terms of setting those things up, you'll have to do that in a different workflow from the one that you see here. Then you'll see the Orders Reconciliation tab, which is, again, probably the best place to work through the orders that you have. Epic has some pretty robust checking and cross-checking features in which orders are checked for a number of different things, safety and duplication and that sort of thing. And you have to perform order reconciliation regardless of how you enter them. And so by being in the order reconciliation activity, you're able to go through all of the things that Epic requires of you for order reconciliation, again, without having to jump between activity tabs in that process. So essentially the first thing that you're doing is looking again at those home medications. You're looking at the inpatient medications, and you're basically going to decide how you're going to deal with each of those moving forward. So we can see over here we don't have anything recorded at home. There's no reconciliation required simply because we didn't have any at-home medications there. And then over here you actually have the inpatient medications. You can deal with each of these medications individually by clicking the plus sign, which would say continue this, puts the order in, and then you'll notice that you get a couple hard stops here so that you can make the decisions about how much you want to write or how you want to write those orders for your patient moving forward. So we're just going to go ahead and we'll answer a couple of these hard stops. And then you'll also notice, I'm actually going to pull up a similar window again here real quick. When you get to a hard stop where you see these stop signs, you're not going to be able to proceed past that screen without having answered the questions that are marked that way. You can look through the window and find them visually, but you also have in the bottom left-hand corner the ability to move through them sequentially without having to find them. So if we didn't know that these three were all of our hard stops and they were scattered out through here, we can start with our first one and enter the information that Epic wants. And if we hit the next required, it'll tell us where to go next and what we actually need to do to be able to clear that stop and move forward. So you can use that to help you through that without having to try to visually track down all of the places where Epic still wants information. Now, let's say that someone else is going to deal with these medications and it's not something that you're going to address at this point, or you're going to stop these medications sort of more in bulk. You can see that you have at the top the opportunity to, number one, find the ones that you haven't reviewed yet. So when you click that, that will pull the ones you haven't reviewed up to the top and let you look through those. And then you can also use the red circle with the line through it here. That icon allows you to don't prescribe. It says don't prescribe any unreviewed inpatient medications. So when you click that, what you can essentially do as a workflow is you can add with the green plus any of the medications that you're going to order to continue, and the red circle will allow you to discontinue, actually enter a discontinue order for anything else there that you haven't already dealt with. Over here in your side window, you have the opportunity to remove all, which is, again, sort of clearing your shopping cart, removing everything in there and starting over. You have the opportunity to save work, which is sort of your shopping cart, save what's in there, but don't check out. And then you have the opportunity to sign those orders and move forward, the opportunity to buy what's in your shopping cart, if you will. Once you're done with that, you have completed the order reconciliation piece. Let's look at the PACU to floor tab, and then we will have wrapped up the interaction we need to have with the surgery navigator.